talking about, how do you strengthen the lab system. I had shown the slide earlier, and what I'm going to do now is, I'll try to go a little bit deeper into, the orange colored text, which is talk a little bit about what are some of the considerations or things you can think about if you want to improve operational and clinical value, thinking about your staff and accelerating collaboration, especially with clinicians. I think other things have already been covered a little bit. So just to step back, and when you think from a lab perspective, I'm going to use a very simple approach, which is if a lab wants to improve itself or do more, there are two axes to think about. One is operational, which means how do you do things maybe to make your processes more efficient, to improve your productivity. And the other axis is clinical, which is how do you really collaborate with clinical departments, clinicians and others to really improve clinical outcomes, right? So at a very basic level, the lab what does it do? It is performing tests and providing accurate and timely results. But as I said, we can do more, and that is the unrealized potential that it has. And what it can do really is not only to influence outcomes of the hospital, not only to improve outcomes of the community, so it can do a lot more, right? And one of the things that we take interest in trying to show that is by measuring things. When you talk to people, you talk to your management, and you say, I want an investment, they always ask you, so what is going to be the return on investment, or what is the outcomes you expect, right? So it's all about measuring. So I'll take a few examples later on and show to you how measuring some of the value that you have already been providing can lead to some good discussions, because then you're truly showing the impact of your lab. All right, so again, let's do a little bit of polling. So let's talk about automation first, and if you can just use a QR code and talk about the status of your lab as far as automation is concerned. So A, do you already have some sort of track system for automation? B, you don't have a track, but you're actively considering something for the future? Or C, you're not considering? All right, so I don't know where the fifth is coming from, E, but okay, that's interesting, isn't it? Anyways, so it's sort of, a lot of you already have automation, which is great, and there are others who are considering. So let's talk about automation just for a second, and you know this more than I do, so I'm not going to go into details of the benefits and disadvantages, but the reality is, yes, automation can help you improve productivity and efficiency, but automation is not for everybody. And it does cost a lot upfront, but over a long period of time, based on enough proof, it shows that it pays out for itself, right? Now, what has happened though is that post-pandemic, there's been a lot more interest. Partly because of the fact that, with human interaction, and safety considerations, you would like to eliminate or reduce as much as possible the amount of human interaction that's happening to prevent, to spread infection and so on. So it's definitely got more relevance now in terms of more safety. And given what we talked about from a staff perspective, now depending on the countries, there are many countries where there are serious staff shortages, not everywhere. So that's another place where post-pandemic there is a realization that automation is needed, because you really do want to, take your limited staff and put them at the right place to do the right things, not things that can be done through automation otherwise, right? There's always, and still is, further pressure to improve efficiency. If budgets are being cut, you need to figure out ways to become more efficient, and automation helps you there, right? But there's also need for automation for smaller labs. So yes, not everybody needs a big track total lab automation, but there are technologies available that can help you do piecemeal and gradually build up, right? So that's what is called as task-targeted automation and things like that. But also there's one more very important element. Automation is not only mechanical, it is digital as well. So when you think about automation, you got to think about its association with digital, and what can you do digitally to automate your processes in order to improve your efficiency, okay? So let's do a second one. And I'm asking a specific question related to digitalization, which is really auto-verification of your analytical results. So are you doing that today through middleware or LIS? You're not doing but are considering, and then C is no. Hopefully there'll be no E this time. Let's see. Okay, so either you have it or you're actively considering, meaning most of the people around here are thinking digitally, what can you do to improve things, which is great. So let's move on. So when you think about digitalization, the way I'm going to just suggest this is you're very familiar with all the lab operations, and that's the diagnosis cycle. It starts with the patient being seen by a doctor, and a test is ordered, blood is collected, it's transported, and so on. You know the process, right? Now, the reality is that in many labs, a lot of these things are still being done manually, which can, of course, require more manpower, but is also more prone to errors as well, right? So there are benefits of digitalization in this diagnosis cycle. And to put it simply, you can optimize your diagnostic workflow using digitalization. You can really improve, actually, diagnostic testing or the value it provides and decision making, and you can help the clinician actually empower them to provide better care. And I'll talk a little bit more about it. Now, I'm not going to go into details, but some insights that are there that tells you why digitalization could help. So 65% of the diagnostic errors today are actually happening in the pre-analytical phase. In the analytical phase, through your instruments and all, we've done pretty good. The errors are much less. Most of the errors are happening before, for a variety of reasons. There are also things like, only 29% of the labs today are monitoring TAT in real time. And you do know the benefit of monitoring TAT in real time. Many labs cannot manage inventory very well today because you don't know what is in, what is out, what has expired. Sometimes you just run out of stock because everything is being done manually. So digital can help you there. 47% of the labs auto-verify the results, which is similar to your polling. Half the people are doing it today. We did, and Abbott, we actually did a big survey a few years ago. We polled hospital executives, doctors, labs, patients, and asked them, what do you think is the value of the lab? And one very common thing that came out is doctors said, we want the labs to tell us more about the tests. We don't know enough. Tell us how to interpret your test. Tell us what is the next test which we can do, right? So these are all things that we can do much more effectively digitally that can help you. And in some ways, when you look at this diagnosis cycle, depending on your interest, your priority, where you think you have challenges, all of these different areas you can do better, whether it is in terms of pre-analytical sample tracking, whether it's terms of quality control, whether it's terms of better interpretation of the test results. All of these are areas where today technologies exist that you can digitalize. Okay? Now, you don't have to do everything. It really depends on the nature of your lab and what you do, but many avenues are open to you to digitalize if you want. Okay, so I'm going to take a couple, 2-3 examples to talk to you about, when you think of a lab, and especially if your lab in a hospital setting, one thing is to have a mindset to think, okay, what am I doing in my lab? The other thing is also to think about what am I doing in my lab that is influencing my hospital or my healthcare ecosystem. So one part of it is like patient care pathways. So, you may not think about it, but I'll encourage you to think about it, that in your system, how efficiently are patients being moved through the continuum of care? Where are their bottlenecks? For example, in the emergency department, is there overcrowding? And I'm asking these questions, why? Because the lab can do things to help here. So I'm just going to take one specific example. And this is coming out of a hospital in the UK, Royal Wolverhampton, where they started doing triage, and many of you would be familiar with troponin. So a highly sensitive troponin I was being used along with clinical criteria to do a rapid rule out. And what did it do? And this is where the measurement is important. They were able to effectively discharge 25% of the patients who came in with chest pain. if you know very well, many times chest pain is not truly chest pain. It is just a manifestation of maybe something in your stomach or whatever, right? I mean, in simple terms. So they were able to use this sort of approach to reduce or effectively discharge 25%. Imagine what it does to your ED if it's very crowded, right? You're rapidly ruling out, people are going out. The patient is happy, the family is happy, and you have a less congested emergency department. So they were able to reduce from 23 hours the time to average to take patients out with chest pain to 9.6 hours, okay? And they were able to reduce 37% of the admissions from ED to the hospital wards, which is saving cost, saving money. So these are all different ways in which a simple test, along with collaborating with the clinicians, which is very important, you were able to effectively contribute to better management of a patient care pathway, okay? These kind of examples exist everywhere. The problem is they are not recorded, they are not measured, and we don't talk about it. So what I would encourage you is to think about this, that, how do you show the value of your lab? Imagine you're having then this conversation with your hospital management and saying, see, this is what we do from the lab. This is how we are improving. And that is why you should further invest in the lab and give us more budgets or whatever else, right? So I would encourage you to think about measurement, because measurement helps you do that, okay? In terms of early disease detection, and this is very close to home in terms of infectious disease, so we do know that, if people are not aware, then there are challenges in proper care, right? You know very well that we are far behind in our HCV eradication program, for example, whatever is the WHO targets, right? 40% of the people who have HCV today don't even know they have HCV, okay? 19% of the people who have HIV don't even know they have HIV, okay? So, and we do know, especially for HCV, that newer HCV treatments have come that can completely cure the patient. So if these were detected early, detected accurately, you can do so much better and contribute to this, right? And this is where diagnostics can play a role. So this is again one example from University of Alabama. So they did something very clever. They initiated an opt-out program for the inpatients. So people who were getting admitted, they said, we're going to test you for HCV and HIV. You can opt out if you want, but we're going to test you. And guess what? When they did this, they detected 2,349 HCV RNA positive patients. They detected 195 HIV individuals. And these people did not even know that they had HCV or HIV. I was having this conversation in Vietnam. Vietnam is struggling with hepatitis today, okay? And the same thing in Malaysia. So I'll quote a Malaysia number. There are 3 million people who go through hospitals every year in Malaysia. So what we were telling the Malaysian MOH is, why don't you start doing something like this that University of Alabama did? Have an opt-out program, test them for HCV, HIV. You'll detect more of these people. So complement your community-based screening with hospital-based screening, and it will help you detect more people, right? So based on this, there was a 91% reduction in the time it takes to provide care to these patients, which is powerful enough. So by measuring this, showing this, we are able to have more effective conversations with stakeholders, with policymakers, to tell them this is how labs or lab testing can benefit you, okay? Then let's talk about staffing matters, because you said this is the most important thing for you, at least in the vote, right? So we all understand how important it is to have a motivated, skilled, and optimally sized workforce, right? It's a big challenge. This is just a survey coming out of the US, which was done recently, and I got it out of the Medical Lab Observer. So they did a survey to understand from the labs, what are you doing for your staff? Okay, so see the statistics. 38% of the labs provided continuing education, 47% offered more flexibility in scheduling, 45% talked about safety, 43% partnered with local colleges for internships, 42% offered financial incentives, 34% offered professional development programs. In other words, they started doing things more for their staff. How do we develop them more? How do we motivate them more? How do we encourage them more? And this is all important, okay? So I would encourage you to think about all of these different kind of things that you could do. And obviously, if you're standardizing your operations, automating it, digitalizing it, you're making life easier for your staff. Nobody likes monotonous, repetitive work. That's what leads to errors. That's what demotivates staff. By doing all of these different things, you're able to get them to then focus on more skilled places, areas where they really should be using their brains more and applying it more, right? So these are all different things that you can do. But now, of course, and especially post-pandemic, one more very important element is change management. How do you change the mindset of your staff? How do you change your mindset? You got to think differently. If you keep thinking the traditional way, it's not going to work, right? So how do you work with your staff and really talk about change, and what do you need to do differently in order to, have a more sustainable business, for example? So this is again another example that I wanted to show to you. So this is coming out of Lebanon. So there, this particular center, they started doing digitalization. They auto-verified 65% of their tests, as you can see. So they were really able to reduce their overtime costs. They were able to reduce 33% in their primary shift staff levels. And because they standardized their operations, they were able to have more cross-trained staff. So, from instead of 20% of the staff who could move from one technology or one instrument to the other, 70% could move because they had more standardized operations. So these are all different ways that you can use, to motivate your staff and to use them more effectively, really, to speak. Now, one more important element that I wanted to bring, if you want to strengthen your system, is to talk about sustainability, and especially environmental sustainability. This is becoming much more of a hot topic now, and you need to think about it. Within the healthcare industry, we need to think more about it, right? So, the choice of how you employ technology in your lab really has a downstream important effect on environment. Why? So these are the questions, how much plastic waste do you generate? Do you measure it? Do you actually know how much you do it? What is your utility consumption? Power, water, and if I can be provocative enough, if you're in a government lab, maybe you don't think about these things because the hospital pays for it, but it's important, especially if you again want to save or have less wastage. Packaging, how many packages come into your lab every day? Are you working with your vendors to make sure that's more optimized? Are you choosing those vendors who have optimized all of these things? Do noise level matters? Do your assays require more dilutions and reruns, which is more wastage? So you need to start thinking about all of these things and seeing how do you become more environmentally conscious and include that in your tender criteria or RFP or whatever, so that you put the pressure on even your vendors to say, guys, we need to work together to do better for sustainability, right? So on the right is this thing from Singapore. Electricity tariffs have gone up by 10%. I mean, all of you get an electricity bill and you must have seen it. It's gone up these days, right? So you need to invest in technologies that help you save electricity. So you have to have that mindset of sustainability as you think about how to have your lab really not only be sustainable, but also contribute to the environment. It's our collective responsibility to think about this, okay? So if I could just then conclude, so there is a lot you can do to strengthen your lab system. That's the reality. You need to have that mindset to challenge the status quo and think, what can you do on your own or collectively with different stakeholders to improve that? Things like standardization, automation, and digitalization are things you should consider. And really, based on some of the examples I showed to you, and you know it very well, lab does contribute a lot to clinical outcomes. Figure out ways to measure it, to show it. Staffing considerations are very critical and cannot be ignored. And then, like as my last slide showed, you got to think sustainability as well, okay? So that's what I would say, to end my talk. Thank you.